Meet Bob. Bob bought health insurance as an employee benefit so that if Betty or any of his other employees ever got sick, they'd be covered. See, Betty's got an insurance card, but that insurance kept getting more and more expensive. Bob found a great solution. He converted the health plan to self-funded, but he didn't want to give up the security of having a nationally recognized name on the insurance card. Bob thought he was getting the best of both worlds, and they showed him all kinds of reports that said they get huge discounts from the local hospitals and doctors. What's not to love, right? Well, Betty got sick. Really sick. Catastrophically sick. And Bob paid a lot of medical claims. Then Betty's co-worker Buck got sick too. Now Bob's really worried because the bills are piling up. What's even worse is that when Betty got well and came back to work, she told Bob that nobody from the insurance had done anything to help her through her devastating ordeal. Bob did a little asking around, and it seems that almost none of his employees have ever gotten help when they're sick. Despite people on Bob's plan being seriously ill, nobody from the insurance called them to offer any medical advice, guidance, or support. Nobody talked with them about their treatment options or how to determine which doctors and facilities were top-notch at treating their condition. And after seeing all the news about pricing disparity, a colonoscopy costs $900 at one place but $4,700 at another, Bob's worried that maybe he's spending more than he should. But he can't really expect someone who is sick to dig around trying to find the cheapest price, can he? Bob pulled out his paperwork and saw that he is paying for case management to be a part of his plan. So why isn't anybody talking to the sick people on his plan? Thankfully, Joe, Bob's benefit broker, introduced him to Nurse Deb from AIM. Nurse Deb and the team of nurses and doctors from AIM specialize in helping people like Bob, Betty, and Buck. AIM's entire job is helping patients to make sure that they are getting the right care at the right time, in the right place, and for the right price. There are two ways that Nurse Deb can help Bob and the members of his self-funded major medical health plan. Option 1. Bob can decide to stay with the big name on his insurance card, but overlay AIM's healthcare concierge services to help patients. In this scenario, Bob and Joe turn off all of the services that the current vendor is supposed to be providing, except the pre-certification piece. Turn off those things that Bob is paying for, but that don't seem to actually be doing anything. You see, that other vendor isn't willing to let anyone else do the pre-cert function because they are super worried that the doctors and hospitals will get upset if someone pays close attention to the care they are doing and what they are charging. So if Bob wants to keep that name on the card, he has to let them keep doing the pre-cert. But Nurse Deb can dial into their computers every day and see what they have pre-certified, and then use that information to call out to the members of Bob's health plan who need the help of AIM's healthcare concierge nurses. That way, his patients can get help accessing best-in-class healthcare services while simultaneously ensuring that cost-effectiveness is happening. Option 2. Bob can decide to give up the name on his insurance card. This could be a super smart move for Bob to make, because while on paper it looks like he's saving a lot of money, he's beginning to see that a discount only results in a good deal if the prices aren't hyperinflated to start with, and if there's not inappropriate utilization happening within his plan. Nurse Deb is able to work with Joe and Bob to analyze Bob's health plan data and tell him what kind of impact each option would have on his claim costs. Usually, they find that Bob could save a huge amount of money. Plus, having the healthcare concierge services of AIM is a huge help to Bob's employees who are sick and need guidance and support. In fact, after analysis, Nurse Deb is so certain of the outcomes that can be generated, she is willing to guarantee how things will turn out for Bob and his health plan members. Whichever option Bob chooses, the next time someone like Betty or Buck gets sick, they will have all the help that they need. And Bob will know that he is taking good care of his employees and his business. If you feel like Bob, maybe it's time you talked with Nurse Deb.